Welcome to the Shared Practices podcast. I have with me today Dr. George Hariri, the Ask George segment. We're going to get into something that we haven't had a chance to talk about quite yet in a long time. It's funny, these topics from the original Shared Practices archived feed now, they're fun to get into. Tell us about what we're talking about today, George.
Yeah, so I think that, I think in our time together, which started for me in 2017 on season 2 of the Shared Practices podcast, if you go back to the archives, we talked a lot about like, what's the ideal type of practice to buy? You know, when you're looking to get into ownership, what type of opportunities should you really be looking for? And we gave the advice that we wanted people to buy the practice that had the most income opportunity, right? So we essentially look for the largest cash flowing practice you could find. That was the advice that we gave when we first recorded season 2. And then what happened is analytics-based practice management came out later, and we discovered that there's a predictable process to grow a general practice at the same site and have that, recare-driven growth. And then we went back to our advice on what's the best type of practice to buy, and we actually realized that maybe we weren't right on with that idea of buying the largest, most cash flowing office. And there's actually something a little better, which is buying a practice that we now call Ready to Grow, which is a practice that has a lot of embedded growth within it. And with the right buyer and the right process, you can buy that practice. And then within 18 months to 2 years, you can have substantial growth by activating that overdue recare pool and, growing the practice quite substantially. And so now we have this new philosophy that we call Ready to Grow. And I think that it's something that we haven't quite talked about on the new feed that we have kind of condensed. And so I think that it would be a good opportunity for us to really just go back to that topic and address it completely, which is the Ready to Grow practice. Why is that what we recommend? And how do you execute that? And, go through all the steps to buying a Ready to Grow practice.
Well, and what I think about is I think of what is the old path that a dentist takes to buying a dental practice, which is they either buy the practice in town, they buy the closest practice to them that they can find, they go on the broker's website. They're really nervous because they're like, is this a good deal or a bad deal? Am I getting ripped off? Am I getting screwed? And it's like almost cross your fingers and hold your breath. And the difference between that and buying a truly ready to grow practice where you know what you're getting and you know the opportunity, there's almost the sensation of like you're holding your breath in the other way of like, I really hope this goes through. I really hope they don't realize what they have on their hands because this is incredible. And this practice, I know there's going to be an instant bump in cash flow, in valuation, and that like kind of like crushing into ownership, just like waltzing into practice ownership, knowing what you have on your hands is an entirely different sensation than, oh crap, what am I doing? And so I think that's the emotional difference between the old way of doing it and the way that we've showed people how to do it.
And I think you brought up what is a great point, which is, you want to have that experience of waltzing into ownership. I think that's a great term, right? You just kind of waltz right in, and it's like, it's you just instantly have positive things happening for you at the practice. And I think we mean, growth, collections growth, production growth, patient flow growth. And, Richard, I think that, last time we had an episode we did together about buyer's representation services and their importance because of we had these anecdotes, right? I referenced Nesto, who's maybe a future Practice Underwater guest that I've recorded, where, the practice shrunk. And then you had that situation where you were talking to a dentist whose practice shrunk. And, I think that I liked your term that we actually used right before recording. You called ready to shrink, right?
Yeah.
And I think that like we had previously discussed the ready to shrink practice. And, maybe that we should start just by like defining that maybe in a couple of minutes for our listeners. Richard, you thought of the term. I love it. A ready to shrink practice is like, it's so succinct and it very clearly explains exactly what happens in these types of opportunities where like the one that I talked about last time, it was that full arch rehab, like full mouth rehab, full arch implants focused practice with 1 day a week of hygiene. And, Nesto bought that practice and then it halved. It actually more than halved. So that was ready to cut in half practice. So it's like, Richard, just kind of talk us to what is a ready to shrink practice, just so we can kind of like get the contrast.
Yeah, I think a ready to shrink practice is the new car you drive off the lot and it instantly devalues. And there's a couple main reasons. I think number one, and probably the chief one, is that there is a overdiagnosis or maybe a much more aggressive treatment philosophy with an expanded skill set of advanced dentistry, a high case acceptance that maybe you can't replicate. There's like a number of factors stacked together where you're like, I don't know if I can produce this fast doing this advanced of dentistry with this high of case acceptance on this small of a patient base. And it's like if any one of these goes wrong, you're kind of screwed. But if all of them go wrong, all of these dip, it's multiplicative and it all comes crashing down. But I think the other idea of this is also the practice that has reached its production capacity. So they're like literally you can't grow the practice. Those could be the same thing. You might have a practice that's like completely maxed out and it's at capacity, and then you really only have room to shrink. Sometimes there's a practice that, okay, we could grow the patient base. We can recover this even though we hit a dip in all of those factors. So I think those are the two main sides of it, is the can I do what this person is doing on all these levels? And then is there room to truly grow the patient base?
Yeah, I think that's great. And I think to transition, I think in our nature, we like to help the driven entrepreneur who wants to grow, right? And so I think for us, the ready to grow practice, like that's where I really want to focus now. And I think that there's something really important that is just a fundamental to this that I want to explain early, and then it'll come up as to why it's important later, which is a ready to grow practice. You need to understand, how does a ready to grow practice grow? And the key answer is through the overdue recare base. So like that's the trick, right? And it's important because let's just say my vision is to have a mega group with 6 hygienists and 3 full-time dentists. And you buy a ready to grow practice with 1 hygienist. It's like, yes, it will grow into a practice that has 2 hygienists or maybe 2.5. But you're probably not going to get that ready to grow to 6 hygienists out of the practice that originally had 1. So there's something to be said about, like, I call it a shot in the arm, where it's like when you buy a ready to grow practice, there's kind of like a one-time overdue recare based shot in the arm that you can get when you identify the right opportunity. And that can get you so far. But it can't take you from like a practice doing $600,000 a year in collections to a practice doing $3 million a year in collections. It can take you from a practice doing $600,000 in collections to maybe like 1.5, 1.6 million. Like, and that's substantial. You can more than double the size of the practice. But there's a point where that overdue recare base kind of runs out. And I want to just take a minute and explain, like, how does this happen? So, it's really about if you have a practice that's been around for 30 years, and for 30 years they have had industry standard or average American dental practice retention, then you're going to have kind of this big back door that fills up over the years, where you're going to have all these patients coming in, getting their cleanings. You might have some new patients coming in, and they might not get reappointed. They might not be as shared practices driven with their retention. And then you kind of have this like growing back door. And that is the type of opportunity you're looking for. You're looking for a practice that has done a lot of cleanings on patients over the years and has a growing back door that you could potentially reactivate. Like, that's really what ready to grow means in our language. So Richard, just kind of any questions around that, or maybe a different way of explaining it to our listeners?
No, I mean, I think this is like such a specific, like it's almost like there's a leaky bucket sitting in a bigger bucket. And it's like they've been pouring water with new patients into the practice bucket, and their retention has been so poor, these patients are just falling out. But like, you still have access to contact those patients. They're still kind of patients of record. So there's this bigger bucket that's like catching the spillover. And the more full that second bucket is, the more you can just like, let's just scoop this water back into the original bucket and poke up the holes. And there's that instant growth that is separate from, it's such an immediate bump, such an immediate injection. It's separate from capacity to grow. It's separate from undiagnosed treatment. It's separate from favorable demographics. a lack of competition, the ability to, there's no marketing going on. There's all these other little factors that can add up to being ready to grow, but they just pale in comparison. Those are like long-term factors of growth versus let's just scoop up the water that's literally sitting around our bucket and put it back in the bucket where it's supposed to be.
Yeah, 100%. And I think that, the thing that we need to really like kind of now explain to our listeners is, I think one of the things I appreciate the most about shared practices is how we always try to start our conversations with your vision, right? You who's listening to the podcast, your vision for what you want practice ownership to mean, and, all of that. And so I think, we gotta start there. And so we call that the vision avatar, which is, what does your ideal practice long-term look like? And, I made the mistake early in my ownership that for me, I had this vision that I would be like a super solo, which like now if you know me, you're like, oh, how did he possibly think that? and so I think that for me, like, I just want to make sure that, for everyone listening, like you're going to take a minute and really think through, what does your ideal practice look like? What does your future look like? And, what is that? And I just kind of go through some options that I think are good options, right? We have our productive solo route, which is that's the solo dentist who wants the predictable 4-day a week, $500,000 a year, like that's kind of the productive solo. 2 hygienists, 2 front desks, 2 assistants. That's the productive solo. Then you have, I think you could have another avatar that we would call the pseudo specialist, which is somebody who really wants to sort of niche down into specialty procedures. They want maybe potentially up to $1 million take home, doing specialty procedures with an associate or 2 underneath them. That's another avatar of choice. The other one is the profitable group, where you have another associate. You might work 3 days a week. Maybe your income 600,000 to 700,000 for a larger group practice. And then, the last one that we talk about is the mega group, where you have that mega group practice that is doing maybe $3 million per year, and you have a significant passive take home in the profit of that practice, as well as, whatever you would have in terms of your production, where you could, be making over $1 million a year as well. And so, like, I think that if I was, and then we do have the smart solo, where it's like the productive solo who goes kind of really intentional with how they set up their processes, and they can make up to $1 million a year as well. But I think that that's kind of a tough one to strive for at the beginning, because you should really get to productive solo and then evolve into a smart solo with time, if that's your growth path. But I think that the first question I would ask myself is sort of on that menu, so to speak, what avatar resonates with you, our listener, right? Do you want to be a mega group? Are you primarily driven on the entrepreneurial side? Are you more clinically minded, maybe the productive solo, smart solo route? If you're kind of in the middle, like you like doing clinical dentistry, but you also like being an entrepreneur, I would recommend either the profitable group or the pseudo specialist route. I think that those would be kind of the ways I would break out these, different avatars, is essentially what type of entrepreneurial risk and burden of ownership do you want to have? And, really identify your vision avatar. And so that's like, in our pathway to ownership, that's something we're going to try to do very early in that course, so that when we do that, then we can essentially frame the whole weekend with that as the target. So Richard, for someone listening, when they're trying to really identify their future practice that they're striving for, what advice would you give them on how to identify what's right for them?
I think number one, it's really hard to know. It's almost like that doctor who, this was me, like, who's like, I want to learn implant dentistry. I want to learn advanced surgery. Just like what you said, you thought that you wanted to be a super GP, and then you got into practice ownership and you're like, you know what? There's a whole menu of procedures that I don't love doing. And you found that out kind of the hard way. But if you buy a ready to grow practice with a pretty good idea of where you want to go, guess what? You can pivot. You've got options. And so I think those who are entrepreneurial know that they're entrepreneurial, and the question is, do you have the stomach lining to like continue to grow as an entrepreneur? And that's the thing that's hard to know. Can I ride out the bumps, the worries, the stressors, the risk? And those who are like not excited to grow, like you should probably pay attention to that. Like if the idea of having 4 hygienists and 2 doctors or 6 hygienists and 3 doctors terrifies you rather than excites you, like follow that emotion. Like no matter what we've said on the podcast, no matter what amount of dollars you've heard people making, um, do the kind of dentistry that you love. And if you're more in that, like, I really do like being an associate where I show up, do the clinical dentistry, go home, but there's stuff that I would do better if I was in charge and I'm willing to try this. That's where you are pre-ownership. Then I think lean towards that smart solo or the productive solo, versus the I've been an entrepreneur, I'm chomping at the bit, and can I find that right opportunity? I think the really cool part is as you identified all those avatars, I'm thinking about what is the ready to grow practice for each one of those avatars. And this is why we do buyer's representation. This is why we have the course, because it looks different if your endpoint is a productive solo. That ready to go practice is different than if your endpoint is a multi-doctor office or you're that pseudo specialist.
I just want to dive right in because that's exactly where I'm trying to go here. And so, if you remember the comment I made at the beginning, which was a fundamental to ready to grow is that you get one shot of the arm. And that's a significant thing. So now you take your vision avatar, and we have like, if this was like a visual representation, you would see kind of, we have our chart, the precision growth pathways of the different ways that we could go. So the productive solo, one pathway ahead is the solo. The profitable group, one pathway behind is the productive solo. And then the mega group, one pathway behind is the profitable group. So essentially what you're doing is you're going one pathway backwards on our diagram, and you acquire the practice that is one growth pathway away from your vision avatar, and then you grow on that one pathway with your shot of the arm of the overdue recare base, and then your ready to grow practice turns into your vision avatar. So that's how our philosophy works now in the pathway to ownership that we teach today. And that for us is, so like let's make this concrete. And I'm going to be kind of brief so I can cover all three. So if my vision is to be a productive solo, then I would be really looking for that, $800,000 or less.
Yep.
Like $500,000 to $800,000 a year in collections. I'm looking in that's my strike zone. And I'm looking for that one to 1.5 hygienist practice that is, has all of the signs of a ready to grow practice, under maybe not so updated, maybe the seller kind of is, on the more easygoing side in terms of their clinical mix and what they like to do, plenty of hygiene patients, some semblance of new patient flow, and then you're looking to get that practice, and then you turn it into a 2 hygienist practice, and then you're a productive solo. Versus go ahead.
And you threw out the numbers, which I loved, is exactly what I was thinking, which is that 500 to 800K. That can turn into a $1.2 to $1.5 million office over the course of 18 months to 2 years, sometimes shorter. It's like that is what is really available to you. And like we find they're not easy to find, but we help people find those all the time.
I think that practice is the one that's the most abundant. So if you think of like which practice for purchase of all the ones that we're talking about is the most easily and readily available, it's the office that we've just described. The right. 500 to 800,000 in collections, like of all the ones we're discussing as the acquisition targets, that one you'll find at the highest frequency. So the next point that I want to make is the profitable group or the pseudo specialist. So those have a very similar ideal practice. And the pathway to there is what we call as a solo to group transition. So you acquire a 1-doctor practice that's bursting at the seams as a 1-doctor practice, and then you grow it into a 2-doctor practice. So we call it a solo to group transition. That's the pathway of growth for you. So you're really looking for, and these exist. Like I saw one time, there was this practice that was doing like 900 something thousand per year, and there was 3 full-time hygienists. So it's like, that's your acquisition target, is you're looking for the solo who is doing as much hygiene as you can find. So you want a single dentist as the owner and as many hygienists as you could possibly find. And usually 2 is like kind of what you're going to see most often. So you're going to see 1 dentist, 2 hygienists, and then an overdue recare base. And I actually bought this practice. So I bought a practice it was 2 dentists, but it really could have been 1. And, historical collections were a little over $1 million, and they had 2 full-time hygienists. And so then we went in there and we overdue recare activated after I had my epiphany and kind of figured out some of the stuff behind our philosophy. Then we filled up a 3rd hygienist. And then we had to get it was like the 3rd hygienist was quick, and then to go from the 3rd to 4th hygienist was a bit more of a grind. So, that's where you're looking to get that 3rd hygienist filled very quickly with the overdue recare base, and then that 4th hygienist that you need to fully become a profitable group, that's where you're wringing the towel a little bit more in terms of your overdue recare base to fill that 4th hygienist.
Okay, so the thing I love is that you've got options with this practice. You can do the pseudo specialist. You can add procedures, maybe get a part-time associate that's doing more of the general dentistry, or even full-time associate. Or you go to 2, bread and butter, 2 full-time doctors with a pretty straightforward path. And I think the number of operatories in space is a big thing you have to
need
pay
at least
attention
6.
to. At least 6, and like 6 is hard. I still don't love
6 is tough,
as a number.
but 6 is possible. 5 is impossible, and 7 is like a stretch, a comfortable stretch. But I had 8 when we bought, and I think 8's a good number.
Right. I think 7, if you're going pseudo specialist, works really well. You're doing more complex procedures out of 1 chair with the 4 hygienists and another doctor. So it's these factors plus, I think that's where you really got to pay more attention to the physical space. And then you have all sorts of options. You get that instant inject and then you add in these other factors that we talked about of maybe a seller who's not diagnosing as much, whose case acceptance might not be great. There's plenty of ample room for marketing. There's, all those good things are just gas that you can add to the fire. But the core thing is it ready to pop off? Is it ready to add that next hygienist and progress towards that next doctor?
And then, I'll maybe briefly touch on the mega group, but mega group's tough. Mega group, you're essentially looking to buy a practice that's like $2 million. You're looking to like max out what a bank will allow you to buy. Yep. And you're looking to get the biggest prophy palace you can find. Like that's what you're looking for if that's your goal. And I don't think there's a whole lot, like it's just tough to describe that in detail because they're so hard to find. Yeah. But I think, kind of taking a step back, I want to go to the topic of like, why should I do a ready to grow? Like, why not just buy the practice that is the size I want? And then I have what I want on day one. And, that was our first round of advice back in 2017, 2018. And what we found when we suggested that is that when you do that, your net worth isn't growing to the pace that it could be. So like, let's just use the specific example of the most common one, which is the productive solo. So the productive solo, let's say, well, I want a practice that does 1.5 million. We're like, okay. So then I'm going to buy a practice that does 1.5 million and I'm going to pay 1.2 million. Then you're going to pay 1.2 million for a practice that does around 1.5 million per year. And then that means that every month you're going to be paying the bank a loan that is double what it would be if you bought the ready to grow practice that has half the loan size. And let's just say for whatever reason in 3 years, you're not happy. Like you're like, I want to move to a different state, or I want to, whatever, life happens. And all of a sudden you go to sell the office. Well, you're going to sell it and you're going to get exactly what you paid for it. And the only nut that you're going to get at the end is what you paid the bank. And versus if you bought the ready to grow practice and you spent 18 months doubling it, then you're going to get half that purchase price as cash in the bank if you choose to move or if life happens. And so I think that it just puts you in a situation where you have a much better, we call it practice 01k, which is your equity in your practice. So the ready to grow practice, it has a substantially higher practice 01k because you have a way lower loan size And also that shows up on a monthly basis with much lower debt to pay the bank. So on a lot of levels, we believe in the delayed gratification approach, where you buy the ready to grow practice, you grow it with the overdue recare based shot in the arm, and then at the end of it, you have the delayed gratification. It took a little bit longer, but it's more profitable each month because of the debt service, and also you just on paper are worth more, and if you chose to sell it, then that would be realized. And also, I think that there's an element that's just a qualitative benefit, where it's like if you buy someone else's polished house, it has all of their finishes in it. But if you are the one updating the practice, you can choose your software, you can choose your x-ray machine, you can choose, like, all of your taste goes into how it grows. And so I think that that's another benefit, is like you get to grow it your way. So I think that for us, like, we very firmly believe that this is the best way to acquire a practice, is buying a ready to grow practice and then growing one pathway through the overdue recare base to get to your ideal vision avatar in a much better net worth position and a much better monthly cash flow position as well.
Well, and not just to mention the bank loan, but also, let's say that you buy an $800,000 practice, or let's say $1 million, because I'm going to do math on air, and so I'm going to suck at it if it's 800,000. So 800,000 or $1 million practice. Let's say it's got 60% overhead. You're cash flowing 400K a month. And that's after debt. That's after, everything. So if you grow that to 1.5, what if your overhead moves to 50% rather than 60%? You go from taking home 400K to taking home 750K, and you have the loan of $1 million practice rather than the loan of the 1.5. And on top of that, the higher the valuation goes, the closer to 100% of collections you could sell that practice for. So, the other thing is that $1 million practice, you might buy it for 800,000, and maybe you can sell the 1.5 for 1.5, and that has to do with the profitability as well. So there's like all these little like marginal benefits that start to stack on: cash flow, valuation, and we used to talk about like the net worth gain of a startup. Startups are getting more expensive, and it takes so long to do a startup. It takes so long to grow a startup that we just go back to this of like, if you could acquire a ready to go practice for the same cost of doing a new startup, the timeline to a massive net worth change and all sorts of options and all sorts of cash flow is just different. It's just so significantly different, so much better. And that is why, like, we still lean acquisition. We still have that slight bias. We help people do startups, but we love when we're doing that buyer's representation and we uncover one of these practices. It's like, hey, this fits your vision. This has potential. This is the waltz into practice ownership situation that you can have confidence. Like, there is meat on the bone. There's room to grow. And even if you just don't screw things up and do a few little things better, you are going to be significantly more better off. And if you can do a lot of things a lot better, and our coaching clients do over the course of the first year, we've had episodes where people have grown their practice 30, 40, 50, 100% in the first year. It's just fun. It's fun to see.
And, I want to kind of talk about our buyer's representation services now and where they play into this, because I think that's where, our philosophy now, as you can tell, Richard and I very firmly believe that the best way to enter ownership for your first practice is that acquisition that's ready to grow. Like, we just believe that's like the way that you should enter ownership. And then, on top of that, I want to talk about like, how do we help people do that? Because a lot of people, when brokers give them that information on how many active patients there are in the practice, that's not always true. And so, it takes, really doing like a deep analysis to really uncover what is a truly ready to grow practice versus what is a ready to shrink practice versus, what is just a ready to stay the same size practice. And I think that that's where, that's where the buyer's representation is really helpful. And the thing that I want to, the first thing you got to understand about our buyer's representation services is an accountant does financial analysis. A financial analysis will not show you what is ready to grow versus what is not. What a financial analysis shows you is, what does this look like if nothing changes? So you say, if nothing were to change, what would this look like? But you're kind of operating on top of a false assumption, because if you take out the owner and put in a new owner, that's like one of the most impactful changes you could possibly make to the practice. So it's like, why are we doing an analysis as if nothing is going to change? Like, the fact that nothing is going to change is just like instantly wrong. So like Richard and I talked about last time, how buyer's representation services protects people from the ready to shrink. And we talked about the full arch. We talked about the number of crowns compared to the number of fillings. And like, yeah, buyer's representation will screen for all of that. Like, we absolutely don't want to have a ready to shrink practice. But on this episode, I want to spend some time on how do we identify a ready to grow practice. So what Suzanne will do is, when we have a buyer's representation service, Suzanne remotes into the practice management software and just goes pulling reports. I mean, she has like a whole library of reports that we pull. And so we get remoted in. We pull a bunch of reports direct from the practice management software, and we're asking things like how many cleanings were done, and how often. We want to see how big is the overdue recare base, how big is the inactive list. Like, we're pulling all of that stuff direct from the software, and we're looking at how many cleanings are being done, how many hygiene days are there, how many patients are overdue. Like, we're really just counting all of those things so that we can have an actual idea of how many patients are overdue and what is truly the size of the overdue recare base. And then we have like this whole library internally of numbers that we compare it to help, prospective buyers really understand what type of overdue recare opportunity they're looking at.
I've walked into practices that were like I was looking at to potentially acquire, and even within the last year, and I open up the practice management software, it is not clear which reports to pull or how to even get the right numbers out. And oftentimes the reports that are pulled and given to brokers, like, the broker can't go pull the reports themselves, because a lot of times the team doesn't know the practice is being sold, and they're dependent on the doctor pulling the right reports and send that over. So if you've ever seen a broker listing and it's got like weird reports and you're like, do I trust this? It's because the doctor doesn't know how to pull the right stuff. And even someone like me who knows what I'm looking for, every software is different. And sometimes the way that you configure to pull those reports is very specific. And like, as stupid as that sounds, this one little, like, how do you pull the right data out of the practice comes from years of experience working with different practice management softwares, analyzing the data. If your data sucks, your report sucks. And like, right from the get-go, that first step, Suzanne is going to outperform anyone else. Like, you just cannot beat the data that we get out of these practices.
Well, I mean, just something to say is, like, most of the time when they list the number of patients in the brokers, like, they call them like information packets, whatever the brokers are sending out, it's literally the seller just telling them what they think. Like, a lot of times it's the seller saying like, yeah, 1,400 or 2,000 or whatever. And then you like see those numbers and it's like, you can't trust that. You got to go verify it. And so, I think that I start with that because I think that's the thing that we do that I don't know anyone else that does that, because like a lot of people will do the financial analysis, and we have our own internal financial team that will do the financial analysis. But like, it's all about the patient base. It's all about the number of patients that consider this office their dentist. Like, that is the real value that you're acquiring. And, you got to get super clear on how active is this patient base? How many people are in the patient base? How many people are overdue in the patient base? Like, that's what you're spending money on. And, like the ready to shrink practices, they all have something in common, which is there wasn't enough patients for the amount of revenue they did, which is why they shrunk. So it's like, if you just nail that one thing, you have so much leeway to make mistakes elsewhere because you have an abundance of people coming through the door day in, day out to the dental office. And so I think that, like, that's I think the most fundamentally like important thing that we do. It's like a 10-page report at the end of our analysis. So like, we're going to look at the financials, we're going to look at everything else, but it's really about, is this practice ready to grow? Is it ready to shrink? Or is it ready to stay the same size? And the patient base is the thing that tells us that information. It's how many patients are there compared to how much collections and production are they doing. And then there's also like the element of what is likely to happen. And I think that we do the financial analysis. We're going to take a look at the crown to filling ratio to see how aggressive or conservative compared to our standards this particular dental office is. But then also on top of that, there's some like oddball things that come up every once in a while, like a Delta Premier practice, for example. If you're looking at a Delta Premier practice, then it's like you have to do some analysis on what percentage of your collections is going to decrease because of your inability to sign up with that insurance. So like there's also tertiary things that come up every once in a while that can be impactful as well. And so I think that, our buyer's representation services are really just a complete deep dive on every aspect of the opportunity with your vision in mind, the financials in mind, the patient base in mind, and kind of putting it all together. But like the thing I really want to emphasize that's extremely important is the patient base. Like the patient base is the thing that is the most important in the whole process. And, if you just go to your accountant to have them do a valuation, they're going to charge what we charge for the whole thing, but they're not going to look at the patient base. And I think that is the biggest thing that you would miss, is not knowing the true impacts. And then you're going to go in, and the episode we talked about before with that ready to shrink office, like that's where you put yourself at risk of that potentially happening.
You're evaluating a business, not a profit and loss statement.
Yes.
And the banks, going back to the point you made to start this off, the banks are assuming nothing changes. What do we expect here? And that is what they can lend on. Like the banks can't lend on growth, which is awesome, because if you can find a practice that is ready to grow, the valuation for that practice should be higher, but the banks won't pay for it. Like they'll say like, well, no, just because you could do this, the practice has not been doing that. So this is the finding the diamond in the rough. This is the finding of the opportunity. And you some of these same numbers and same factors can be indicators of the ready to grow practice or like an unhealthy practice. And until you dig deeper in the data, you can't tell. You can't tell what's really going on with this. And we just love this. And we love those episodes. You can go back and listen to episode after episode after episode where someone did buyer's representation. They did coaching with us for the first year. And they waltzed. It was still nerve-wracking because they're a new owner. It was still stressful. They still had their bumps. But their first year of ownership had so much growth and potential because they did it right. They got the data. They evaluated a business like a business rather than like a profit and loss statement from the perspective of an accountant.
Yeah, and I think there's one thing I really want to leave our listeners with before we wrap, which is this whole idea that if you're listening to this episode and it's very topically applicable to you, that means that you are a pre-owner who wants to become an owner. And that means that you might be an associate. Maybe you're going, 4 days a week to an office and you have an income to show for it. And you're about to make a decision to go somewhere else every day to do your dentistry. And when you go somewhere else, like you're going to get an income associated with that. And in the Ready to Shrink episode, you kind of heard some horror stories about how some people went from an associateship to a worse situation in ownership. They have more work, they're making less money. In this episode, we try to have maybe more positive spin on it, which is like when done well in that ready to grow practice, you can kind of every day drive to a different place, have that place be a thriving, growing business where you're waltzing in to a practice that has some, opportunities to grow. Maybe there's opportunities to grow the case acceptance. There's opportunities to grow the procedure mix. And most importantly, there's opportunities to reactivate that overdue recare base. And if you walk into that type of opportunity, it's going to feel like a downhill. It's still going to be tough. You're still going to have your memories. You're still going to remember early ownership, but it won't be the same way as the others who are having that regret, right? I think the regret is the hardest part where you're like, I was better off before. Like, that's not a good place to be. And so, I think that I really just want people to remember, start with your vision avatar. What's the end goal? And then you waltz into a ready to grow practice and you just kind of walk it there to that vision avatar. and you're very clear on what you're doing, you're informed, you're aware, and you're going through that process. Like, that's really what we want for all of you listening, is to have that experience, because it's such a crucial, it's probably most dentists are only ever going to do this once. And it's the single most important decision that's going to outline what does the rest of my career look like, is which practice do you go from your associateship to your ownership. And that is just such an important decision.
This has been incredible to revisit this and drive this home for our listeners. George, wrap us up with, tell us a little bit about the upcoming event and take us home.
Yeah, so July 25th, 26th, we have a 2-day course, Pathway to Ownership, where we teach all about the Ready to Grow practice. So we start with a lot more information about the vision avatar and how to identify that. I talk about acquisition targets. We go through step by step how to do the steps involved in getting into ownership. We talk about early ownership, how to grow that practice. It's just a 2-day immersive experience into really diving deep into this subject about how to acquire a ready-to-grow practice, how to identify it, how to go through the steps, and also, how to grow that practice post-acquisition. So really excited to kind of have that opportunity to teach the Pathway to Ownership in July. And, if you're listening and you're in that phase of life that you're looking to buy your first practice, like, you've got to come.
And it doesn't matter if you're a dental student, if you're fresh out of school, if you're a few years along, like, this changes the rest of your career. This one course, there's like 1 or 2 slides in this course that change how you look at ownership for the rest of your life. And it's just fun. You need to be there. So thank you, George, for having this discussion. This has been amazing.
Yeah, absolutely. Thanks, Richard.
And we'll talk to you next time on the Shared Practices podcast.